I'm going to go ahead and start the webinar. Welcome everybody to the 2018 National Healthy Homes Month webinar series. National Healthy Homes Month offers an opportunity to learn more about housing and its impact on health and provide resources to encourage local activities, as well as empower families to protect themselves from hazards in their home. This June's outreach activities aim to greatly boost awareness and understanding of what federal and local resources are available to make a difference in the lives of all residents, regardless of where they live. For more information about National Healthy Homes Month, including resources for your program, you can visit www.hud.gov/healthyhomes. Today's webinar is Forming Healthy Homes Coalitions with a fantastic panel presented by Brandon Kitagawa, California Healthy Homes Coalition co-chair, Jill Bednarik, Colorado Healthy Housing Coalition coordinator, Patricia Barnes, Ohio Healthy Homes Coalition executive director, and Mary Shu Schottenfels, ClearCorp's Detroit executive director. We're pleased that you have all joined us for this event. This webinar series is sponsored by the HUD Office of Lead Hazard Control in Healthy Homes, the USDA National Institute of Food and Agriculture, and the National Healthy Homes Partnership. This webinar will last approximately 60 minutes with 15 minutes at the end for questions. At the end of the webinar, you'll be given information on links to additional resources for your program. We will be recording this webinar and posting it for your viewing later if you prefer. Finally, we ask that you mute your microphone during the presentation. You may unmute your microphone for questions at the end. If you have questions before then, please feel free to post them in the chat window. So what we will do is we will go ahead and get started, and I will change the presenter to Brandon. And Brandon, if you'll go ahead and accept.
All right.
Okay, we can see your PowerPoint
you all see my screen?
Yes.
All right, I'm going to get rid of, okay. Now I can see my screen too. Okay, well, good morning or afternoon, depending on where you're viewing this webinar. My name is Brandon Kitagawa. I'm with Regional Asthma Management and Prevention based in Oakland, California. And as was mentioned, I'm a co-chair of the California Healthy Housing Coalition. So I was going to kick this webinar off giving a little bit of background around the formation of the California Healthy Housing Coalition, and then also providing a little bit of background around a national healthy housing learning community that we also help coordinate. And then we'll pass it on to the other panelists to talk about some of the work going on around coalition building in other states. So the California Healthy Housing Coalition is a diverse multi-sector coalition that has both community-based organizations and folks from government agencies. We have folks from public health and code enforcement, environmental health agencies, folks from tenant right organizations, legal aid organizations, and then groups that work on specific health issues like asthma or lead poisoning or other healthy housing related issues. And we're formed to promote healthy, safe, energy efficient, and affordable housing, particularly focusing on the needs of low-income communities and communities of color, and really for a purpose of looking at state-level solutions to some of the local healthy housing issues that we're facing across the state. And so just a little bit about us is focusing on state policy. We have been fairly successful trying to pursue policy issues in the California legislature. Through 2013 through 2016, we've had 6 bills signed by the governor related to sort of improving issues related to pest infestations or mold, and currently are working on, have some members working on legislation related to lead hazards and trying to get California to administer the EPA's renovation, repair, and painting rule. And so mostly what we're going to talk about today is the formation and how we built the coalition. And I think we were a bit fortunate in that the National Center for Healthy Housing had some funding to work with some local partners in California to host local discussions around healthy housing issues where folks could identify priorities and come up with plans on how to work together at the local level. And so those meetings were held, from San Diego up north, up through Sacramento, across the state. And then those involved in those local meetings were then able to meet all together as part of a broader symposium on asthma in housing, where folks shared their local priorities, identified where, that many of the issues that we're working on locally were shared, whether you're in the Central Valley, Southern California, or Northern California, and identified that there was a lack of a statewide voice on these issues, and that there were barriers at the state level that were hindering some of the work we were doing at the local level. And so there was, sprouted an idea of, could we network together and create the statewide voice and try to address some of the state level barriers to some of the common issues. And so, a handful of folks continued meeting, brought people back together early in 2010 to, say, okay, what would be a purpose of a statewide network? What are some of the priorities that we have in common, from habitability and code enforcement to sort of the connection between green and healthy housing, and then some of the data related to healthy housing were the three main issues that we focused on. But a lot of it was talking about structure and sort of what are the rules for decision making and how we want to move forward. And we sort of set those pieces in place, and had folks start setting early priorities within each of the working groups around code enforcement, green, healthy, and affordable housing and healthy housing indicators. And then the provisional steering committee sort of started work to formalize guidelines and structure that led to sort of a formational meeting and our first annual meeting in 2011, where we finalized guidelines, elected a formal steering committee, updated on some of the preliminary discussions of work groups, and then we held the meeting in Sacramento, and so we used that as a way to then spend half a day at the legislature meeting with some local representatives to just introduce our coalition and our issues to folks working in the legislature. And that sort of got us moving from there. So I think others will get into a lot of these issues in more detail with some of the key lessons that we learned. And you can sort of see the timeline. It did take a long time because we had non-government, government, people from across the state, so a lot of relationship building and trust building, and also making sure that everyone was bought into the idea and that the priorities that we landed on were ones that we all shared, and really being clear about the roles of different members. I think because we had a very specific policy focus, trying to form the coalition in a way where people work for government agencies felt comfortable participating, since they often are limited in terms of how they can advocate. And so we definitely designed rules around the coalition specific to that. So a lot of the policy work isn't done under the name of the coalition, but individual members that can do the lobbying do that. But a lot of the policy identification and development happen within the coalition. Another key piece was having a core group that really was committed to moving this forward, as we didn't really have a lot of dedicated resources for this. Most people were doing this because they saw value in it and without, specific grant funding. And then our policy work, we were a new group to the state legislature. And so we didn't start with our big ticket, hard to win items. We started with very, what we thought were easy and simple wins that would help us gain a presence and a little bit more traction. I think once we had our first bill signed, it was much easier to find folks in the legislature willing to introduce other of our bill ideas. And so that was sort of our long-term approach. So that's how we were formed and some of the key lessons. Wanted to take a couple of minutes then to talk about the National Healthy Housing Learning Community. After the coalition was formed, we were able to find some funding specifically for some of the state policy work. through the Kresge Foundation. And one of the things that they asked is that after we had some successes at state policy, they asked us to share our model and what we've done with folks in other states that approach healthy housing from a state policy perspective. And what we decided was that rather than doing a California roadshow, we thought that California is probably one of many states that had lessons to share and learn. And so we reached out amongst our networks across the country to identify folks that were either working on or interested in state healthy housing policy issues, and formed this national learning community to not only share what we've done in California, but to allow folks to hear from colleagues in states around the country working at various stages along a wide range of state policies related to healthy housing. And I think it's been a very good network in terms of representation, in terms of geographic states, from more conservative to more liberal states, and sort of seeing sort of broad range of contexts in which this type of work is being done. And so I think if this is an area that folks would be interested in connecting to, I think contacting me or the hosts of this session could get you connected to this learning community. So I think with that, I think, Michael, you can start passing the controls to the next speaker, and I'll introduce Mary Sue Schottenfels. Ms. Schottenfels is the executive director of ClearCore Detroit, a Detroit-based nonprofit working on the issues of lead, asthma, and energy efficiency. For the past 19 years, Mary Sue has directed local and statewide efforts around healthy housing, lead abatement, asthma reduction, advocacy, and policy work, both in Detroit and around the region. ClearCore has been recognized as a nonprofit leader in the fight to improve housing and children's health. So I will now hand it over to you, Mary Sue.
Thanks, Brandon. Hi, everybody. Again, my name is Mary Sue Schottenfels. I'm the executive director of a local group here in Detroit. And while we have many coalitions, we do have a statewide coalition on lead called the Michigan Alliance for Lead Safe Housing, and as well as local efforts, the Detroit Lead Partnership and Lead Safe Detroit. I'm going to focus in today on a very local effort that has been a very active and successful coalition that we formed a few years back, and it's called the Detroit Enforcement Work Group. And now I'm going to try to advance my slides. This one? Okay, one thing I'm not is high tech, so here we go. A little background on ClearCore Detroit. We're a local nonprofit. We've been around for almost 20 years. And our mission, like most of yours, is to work to prevent lead poisoning and create healthy homes for children and families with a variety of strategies. Our focus areas are lead, and although we have many aspects to our lead work, our premier aspect right now is that we have a large HUD and State of Michigan grant to abate about 150 homes per year and all that comes with that. With asthma, we've created the Healthy Homes Plus Asthma Partnership with a local Medicaid HMO, and we've piloted a housing and education intervention looking to prove to the health system that there is a return on investment for doing these front-end fixes on homes and with families with children with asthma. And then we've taken on recently energy efficiency work. We're looking with our local utility to replace non-energy efficient refrigerators and furnaces. We've replaced about 4,000 refrigerators and 50 furnaces. Just a little bit on Detroit's housing profile, since our group is very focused on housing. To the top right, you'll see what a beautiful house in Detroit looks like, and we've still got many of those that are looking great, and the market's coming back. And below, you'll see pictures of a house that was a before and after house for lead hazard work. And I know you can't see it all that well, but the turret and the peak and the windows have all been replaced on that house. So Detroit has about 300,000 housing units. Different from most cities, it's mostly single family. Believe it or not, 40,000 houses are on a list to be demolished, and the city's well into to that effort. We're making sure they do that in a lead-safe manner. On the other hand, thousands of new units are being built. Our downtown and midtown areas exploding with new properties. But there are still about 100,000 rental properties, and the vast majority of those are built before 1978, and the vast majority clearly have lead hazards. So in 2008, we formed a new coalition called the Detroit Enforcement Work Group. We started as a small group who had identified that there were some laws available to us, but they weren't really being enforced effectively. So ClearCore Detroit started that group with also funding from the Kresge Foundation. And our goal was to hold rental property owners accountable for lead-safe properties. Luckily, we had a city council member that came to us and asked us to start this effort, Sheila Cockrell. She was our first chair. And our goal was looking at how to both enforce current laws and improve them. And I'll be talking about two, one a code and one a law, and what we did with those as a coalition. So the coalition, began small and grew, and as other people have and will describe, we've got all the constituencies at the table. We've got all the 3 city departments working on lead. That's housing, building and safety, and health. County government, obviously lead folks, state government, the local university who does a lot of data analysis, legal service groups who are kind of newer to our coalition, and they're helping us sort out some of the landlord-tenant issues, several local nonprofits, the local think tank called Detroit Future City, and the statewide Environmental Council. We have about, we meet every other month, and we have about 10 to 20, sometimes 25 people at a meeting. So the coalition has come together for a very specific goal, and one of the things I recommend with coalitions is 2 or 3 very clear and concise goals that you can work toward, and we've had good luck doing that. We've got 2, as I said, codes and laws we're working around. In 2004, our governor signed a package of 3 or 4 state of Michigan bills around lead. The one that is most relevant to our community is they created a Michigan landlord penalty law, basically saying that rental property owners cannot knowingly rent properties out with lead hazards, and there's criminal penalties if they do so. Then in 2010, the city of Detroit, with our help, passed a property maintenance code lead amendment, and for the first time in our city, all rentals must have a lead clearance before renting out the property. And that's every house, whether there's a child or a lead-poisoned child, as long as the house is built before 78. So what are the accomplishments, and then what are some of the challenges? With the Detroit Property Maintenance Code lead clearance, we had the initial law written and code written, but recently we amended it further. The Enforcement Work Group helped write and was key at speaking at city council hearings. This one is very, I think, good and radical in that it allows tenants to withhold rent if a property owner continues to rent the property to them without getting a certificate of compliance with a lead clearance. It also says that a rental property owner cannot continue to rent their property and nor get a certificate of compliance if they have more than $1,000 in property taxes, which many, many folks in our city do. So we got it passed, and then we helped work with the mayor's office to create an aggressive rollout plan, because as we learned from all our coalitions, plan is only as good as it's being implemented. So in our city, this plan is being aggressively implemented. And we also helped target into the most highly lead poisoned zip codes. When they first decided to target this effort, they picked areas that were more, I think, upscale, had less lead hazards. And then we stepped up and said, this coalition says you really need to focus where there's lead poisoned kids, and they are doing that now. And this group also helps to identify and target larger rental property owners, and more about that in a minute. Some of the challenges have been, as you all know, that landlords are resistant to fixing up their properties. They cite low property values, and our response back is just like you would have to fix stairs or electrical or plumbing in a house, lead is like that. It has to be addressed to make a house lead safe. We've also got a lot of large landlords that are buying houses off the tax auction, thousands of houses, and then presenting their tenants with a bogus land contract so that they can skirt these new laws. We're working very hard with legal services to try to go back against these landlords. And in fact, I just heard today, one of the landlords we've been focusing on is in jail at the moment because he has just flaunted and flaunted and flaunted this law. And we credit our group because that landlord was brought to the attention of the building department through our efforts. The penalty phase is not as strong as it can be, though, with this law, in that the fines are small and it's hard to chase down landlords to collect the fines, so we're working on strengthening that. The other law we use is the landlord penalty law. This is a statewide law. The difference in this one is that you have to have pre-notified the owner, the rental property owner, that there's an issue. But we've gotten Wayne County Prosecutor's Office to actively use it and the Michigan Department of Community Health. So with both those agencies, they are holding hundreds of properties accountable. We also are amending that law as a group because we also feel that that could be substantially strengthened. And that's what this slide says, that the law needs to be amended, and we're trying to get other county prosecutors throughout the state to enforce. This is also a criminal statute that can also hold jail time. So we're getting real serious in the state about lead, which is a long time coming. Our goal for this coalition is to amend the state law to continue to prosecute under the landlord penalty law, to strengthen the penalty phase for the property maintenance code. And a large effort has to be continued to identify and hold accountable larger landlords. In fact, we spoke at a seminar today for rental property owners who are just starting to wake up to this issue. The bottom line for coalitions is very similar to what Brandon just said. I would say that each constituency makes you stronger. So continue to build, as you build, look for constituencies that haven't been at the table that maybe should be. And an example is legal services. We never had them in our coalition, and as the issue with bogus land contracts came up, we invited them. They've been a strong partner. Second thing is meet where your partners are accessible. And by that I mean literally. We had meetings out in our offices and other venues, in the city building department, which is the one that works with this ordinance, wouldn't show up. So we started to meet in their office, and it's great because they're at every meeting because it's right down the hall. So figure out who your power center is and meet where it's accessible to them. Be reliable, and I mean hold regular meetings, be reliable with notices, be a good partner. And I guess I mean by that, not only expect people to help you in your initiatives, but go to the state legislature when a law needs to be passed. Speak when people ask you to speak. Pass out their literature. Make connections for them. So really keeping your coalition strong has to do with being a good two-way partner and never stop growing. I think it's very important that you continue to bring new folks to the table as you challenge yourself to find the new nuances in the issues you're working on. And with that, I will just tell you that we're ClearCore Detroit. If you would like a one-pager about our Detroit Enforcement Work Group, you can email Chris Ross at clearcoredetroit.org, and I'm sure these slides will be available. If you'd like to see more about the City of Detroit Property Maintenance Code Amendment, you can get it off the Detroit website, and that's here. With that, thank you very much for all the good work you're doing. Thanks.
Okay, so Patricia, I made you the presenter.
Great. So while we're moving the controls to the next presenter, I will introduce her. So next we have Patricia Barnes from the Ohio Healthy Homes Network. She is the executive director of the Healthy Homes Network and was a founding member of the network's predecessor, the Help End Lead Poisoning, or HELP. Prior to joining HELP and OHHN, she was the founding executive director of the Ohio Community Development Corporations Association, where she served from 1984 to 2009. So I will now hand it over to Patricia.
Okay, I'm not sure if people will be able to see this due to the screen for the webinar.
Yeah, I think right now you're not, yeah, there, we see it perfectly now.
We see it perfectly.
Okay, good. Okay. So I'm going to start at the beginning. We began as a statewide coalition around lead. focusing on children, and it began out of legal aid. I became involved because I was with the Ohio Community Development Corporations Association, and I began attending their meetings. I was worried about what they were up to. I was afraid they were going to somehow impose requirements on our little nonprofits with housing units and somehow force them to abate the lead without any resources. And of course, that was pretty far from the truth. And during that process, I listened to a number of parents and really became convinced I needed to get personally involved and get our organization involved. So I was part of a group that went ahead and incorporated help, even though I would have to say there wasn't a lot of support out there from the funding community. Our startup funds came from a foundation, the George Gund Foundation, but we haven't had that kind of support ever since. That's been really a huge challenge. However, in the beginning, we worked on getting a legislative lead working group in the state budget, which was led by the two legislators who would bring it into the General Assembly, and were successful in getting it passed. The main thing that House Bill 248 did was it made our lead hazard control orders enforceable. Previous to that, they'd been just advisory. So now if you have not satisfied your second lead order, the property can be ordered vacated and placarded. That doesn't mean you might not get prosecuted at the municipal level for having a boarded property that's deteriorating. So that's kind of, I think the landlords at that time thought that was a okay trade-off, because they could leave the property vacant indefinitely, but cities are impatient with that approach and they're taking owners to court. The law also required testing on Medicaid, kids on Medicaid and high-risk kids for the first time. So this has been a tough road in terms of enforcement. It's been somewhat uneven. We've had, as all of you have been influenced by what happened in Flint. And then the Cleveland Plain Dealer has done a 3-year series called Toxic Neglect on the lead problem in Cleveland, which has had a major impact on enforcement statewide. Around that time, the city of Toledo passed a lead ordinance requiring a lead safe housing certificate on 1 to 4 units. So all of the coverage put a lot of attention onto the poor enforcement of the law in terms of, a number of families would often move after a lead diagnosis, and the health departments would have great difficulty finding them, and they were allowed just to more or less give up after 3 tries. That's been changed. The state revised their public health lead investigation manual last June, so that there's a very short time frame to contact the family, and they have to go to much greater lengths to reach them. So it's resulted in fewer no contacts and more cases being investigated. I also have an aside here that we had our own little lead and water crisis in Sebring, Ohio. And while these two issues have not come together very well, the issue of lead and water has been so broad that it's touched a lot of people who never even think about lead. So it's helped to refocus on the larger problem of lead-based paint. As I mentioned, so now we have more lead orders being written. In Columbus, owners are being aggressively prosecuted over these properties, especially those who have re-rented the property and torn down the placard and, never got clearance to do so. Properties are getting placarded, of course. They're down almost as soon as those placards are up, and some cities like Cleveland have not prosecuted owners who have tenants or force those tenants to get out. They're worried about displacement, and this is a big controversy right now. So one good thing the Department of Health did recently was to post the lead data and a list of hazardous properties in their public health data warehouse, and currently 700 properties are on that hazardous property list. So to give you a perspective on what the situation looks like, I'm going to go back here 1 second. Every time I try this, okay, there we go. So we had almost 170,000 children who were tested for lead in 2017, and of these, close to 5,000 had elevated blood lead levels. And in Ohio, a few years ago, they changed the regulations to include children testing at 5 and above in the totals. So we're at 1,500 unconfirmed. That's the other thing they did, was require a second venous test if the first one was a finger prick or a paper test. So you can see where we are now. Of those 4,717, 23 with levels 45 and over, 1,373 were in the 10 to 44 range, and the majority are between 5 and 9. Our state regulations do not require an investigation between 5 and 9. Health departments are required, however, to contact the family and administer a questionnaire. They can also conduct home visits if they want. And this, just a note here to say that we have come quite a ways. The most recent, or the oldest data on the Department of Health's website is from 2006, and they did not count children 5 to 9, but you can see the difference between the 2742 that were at 10 and above in 2006, and we're now at about 1,400 that are 10 and above. So Cleveland, of course, is the most highly impacted by lead poisoning, and there's a lot of activity going on there, which I can mention later. You can see that 11.6 is the percentage. They believe that their testing level is too low for the actual number of EBLLs, and there's a big effort to test children in preschool and kindergarten before they enter school, and they're looking for the resources to expand a pilot project in that area. So in 2011, our board decided we needed to address more than lead. There were a lot of other issues that we wanted to investigate and get involved in. So we did adopt a new mission statement, and we have pretty significant participation from affordable housing finance groups on our board. And this is affordable housing is a big component, and we try to work with Ohio here in Ohio, which is a coalition on homelessness and housing in Ohio, hoping to bring those streams together more of affordable housing and healthy housing. We are continuing to focus on lead, however. There really are no other groups working on lead at the state level. We've got a lead coalition in Toledo and a lead coalition in Cleveland. No other advocacy groups that we're aware of that are working on lead. So it's been tough to expand our focus beyond lead because there's still so much to do and there's really no one else working on it. But we are looking into indoor environmental air quality in a couple areas. One is asthma triggers, and another one would be possibly radon. There's a group here in Ohio that's looking at radon disclosure legislation, and we're looking for ways to work together with them. So the first things we did were to partner with the Lead Hazard Control Grant, and also with a grant that was in Appalachia to kind of leverage that. We've done a lot of educational work, and I'm going to go back here for a second. We built a website, and we began holding annual Healthy Homes conferences, which the state of Ohio has done these sometimes, but has not done that in recent years. It's a big gap, so we've been trying to meet that need. So we have a half-time person, that's me, a $35,000 budget. In 2015, 2016, we, inspired in part by what was happening in Toledo, we looked to gather groups together to change Ohio's lead law and wanted to follow the similar process we did back in 1999 through 2002, where we started with a working group. Go back here. And we, in particular, were looking at Toledo's lead ordinance that targeted the 1 to 4 unit rentals. So similar to 1999, we worked on getting a required lead study group in the budget. And we worked with Senator Peggy Lehner, who is a Republican in education, and she agreed to sponsor the amendment. However, at the same time, a legislator who is a real estate investor in the Toledo area, who was very upset about the Toledo lead ordinance, slipped in a preemption amendment into the House version of the budget. So it became all about trying to stop preemption. And with preemption, we're talking about that only the state law would prevail. It would negate all local lead laws. And this is the first time we had worked with a huge group of stakeholders, all the major cities in Ohio, municipal league, hospitals, the religious community. It was a big tent. I'm going to go back. I think I skipped something here. Okay. All right. We worked with a large group of stakeholders, and we won that fight but lost the lead study group. Since that time, we've had a small grant from the CareSource Foundation. We realized we needed a stronger base of parents to work with us. The parent stories were very convincing during the preemption fight, as well as to promote the idea of bringing groups together to work on a new state lead law. So we have worked with them to get them involved in meetings at the state level, to share their stories in a lot of different venues, meet with legislators, etc. And I think I got these out of order, so forgive me here. I'm going to go on to the next slide since I mentioned that. So parents have been excited about the impact of their stories, and actually it's kind of spurred a movement in Columbus to look at some type of lead-safe housing ordinance here. We don't have an organized group, however, and we are, as an organization, we are somewhat torn. We have very little staff, but the activity is really at the local level right now, and that's creating some questions about what direction we're going to take in terms of state policy. So we've been working with a number of parents to draft and publish their stories. One parent story, you may have seen this in Undark magazine. Shakira Norris and her son Michael had a lead level 30. Really, really rough journey trying to find lead safe housing and then get it abated. It's been very hard. So our challenges are that given the funding environment here in the state and the controversy around lead, and some other issues that we have looked at, it's been very hard to get a stable base of support and to find statewide partners to work with us. So I mentioned that Toledo's ordinance is actually going to become, it's going to hit the first group of properties, I believe June 1st. They're going to have a lead safe housing certificate. Toledo's ordinance has prompted a huge backlash from the real estate investment community. So they are busy struggling with that. Meanwhile, in Cleveland, they have a proposed lead safe housing ordinance. They got their first hearing last week, and they are trying to move forward on a law similar to Toledo, but different in that it requires a full lead risk assessment, not just a clearance review and inspection. We haven't had any interest within the asthma leadership at ODH or in the Department of Medicaid for asthma home interventions, and we are hoping with the new governor, which we'll get in November, that's going to change. And ODH, while they've been a good partner in the past, they're not currently partnering or collaborating with us. So we hold these forums a couple times a year. It's really unbalanced somewhat in that the health community is very interested in the material, and the affordable housing and weatherization field are still hesitant to understand how it's going to benefit them. There are no resources at the state level for healthy homes activities, and nonprofits can't access the lead hazard control grants directly. And we also have some small cities in our membership, and they can't compete well with them, with the larger cities. We serve on the Ohio Lead Advisory Council. We're a statutory member. However, we have no authority, visibility, or ability to affect change, and it's quite discouraging. The Advisory Council needs to be restructured whenever we can get the state law changed. As I mentioned, we are hopeful that the next governor is going to prioritize these issues more highly. However, I'd say John Kasich has done some things with lead. He did go after a Medicaid waiver to allow lead funds to be used for abatement. And also they are creating a lead safe housing registry. We have our issues with how they're doing it, but those both are good steps in the right direction. So quickly, my tips would be, from our perspective, we needed to involve people who were most affected by the issue, because they really had the passion. A lot of the agencies, and whether they're from health or housing, they often don't have any personal experience with lead. So it was really important to get the parents involved and get their stories out there and make sure that they're at the table providing their advice. We've also had some good experiences with journalists, the Plain Dealer, the Blade, Dispatch, even the Inquirer. Mostly, though, that's about lead and water. They've been very good about providing coverage, Dayton Daily News. So there is a fair amount of support for moving in the direction of lead safe housing among those editorial boards. And we've really tried to work towards building a relationship with local advocacy groups, so we're not all going off and doing our own thing in the area of lead in particular. This is a very active time. Things are changing every day, it seems, either in the enforcement of the current law or new proposals coming out for lead laws. So we are working towards a coordinated approach and diverse perspectives. We need those diverse perspectives on our board. We have a representative of both the Toledo and the Cleveland Lead Coalition. And we are working towards, even though people have their own ideas about what lead safe housing is, we are working towards unity. And here's my contact information, and thank you for the invitation.
Great, thank you, Patricia. So while we're getting the next presenter slides up, I will provide a little bit of a bio for Jill Bednarik. She is the State and Communities Tobacco Policy Manager at the Colorado Department of Public Health and the Environment, where she directs the Youth Tobacco Prevention and Secondhand Smoke Initiatives. She has worked in tobacco control since 2005 and has contributed to policy efforts to reduce exposure to secondhand smoke among multi-unit housing residents, workers, and the public, and to reducing illegal sales of tobacco to minors. So with that, it looks like Jill has her screen up. I think you just put it in the slideshow, and you should be ready to go, Jill.
Thank you, Brandon. Oh, there. Now I just now got the question to share the slides. Are you able to see the slides?
I think we have your desktop now.
bring this over to the right spot. There's my family. Then you're probably looking at how this. I'll move it. I've got two screens is what the problem is. I was trying to. Do you see it now?
Yes. We see 6 slides altogether.
Okay, I'm trying to.
So if you do your regular slide, if you put it in the slideshow mode, I think you'll be good.
Yeah, I've been clicking that, and it is just not taking it. Huh. Take it out of this one and see if I can get it to.
Oh, I think we got it.
Okay. Hopefully you're seeing the right one. Like I said, I've got two monitors, and I can't really tell what you're seeing. Anyway, thank you for the introduction and the invitation to be able to speak with you today. As you've heard, I'm Jill. I'm from Colorado. I've got a little picture here of where Colorado is. This is actually, then the housing there is from some renovations in Denver public housing, and there's some new housing stock that we were really pleased with how they've taken a healthy housing approach there. I want to talk a little bit about the Healthy Housing Coalition and give you a bit about how we formed together. I'm really inspired by the presentations of the other folks on the panel and taken quite a bit of notes that I'm going to take and apply to the Colorado Healthy Housing Coalition. But I've pulled up the slide now where it talks about environmental hazards in the home and how it harms millions each year. Really what I want to, I don't need to educate this audience on why this topic is important, but I'm showing you this slide because I want to show you how we have talked about healthy housing and taking a cross-discipline rationale and purpose for the coalition. In that top paragraph, we talk about how it addresses multiple topics. In there you see radon, paint from lead, water, heating, plumbing, pest problems, a variety of different housing problems. And then in the next paragraph we talk about, or the next sentence, what are the health consequences to that? And then the third part is then what's the financial cost that we all bear and that can be reduced through a healthy homes approach. So we started with this type of a rationale and then came together and formed a mission and goals and aiming our efforts towards the outcome of reducing public health inequities and improving health outcomes relating to housing. We debated for a while talking about homes versus housing, and we thought that we really did want to prioritize housing, multi-unit housing, if we could, because of someplace where a policy change or a regulation could impact many families, and particularly the low-income groups that are disproportionately impacted or burdened by poor housing. So those are some intentional decisions on our part. But so I'm going to back up and tell you a little bit about who we are. Here I've listed different groups within the state public and environmental health teams that are involved. We sought out different partners. We all have our own separate funding streams and our own separate action plans and priorities that we are charged with doing. But we thought, let's work across our divisions, across our groups to form a healthy housing coalition and look at the shared health concerns that all of the different, whether we are working on radon or lead, or in my case, secondhand smoke exposure, let's look at what we can do together to address these issues. And then we've also involved a network of external partners, from local offices, other state and federal agencies, as well as hospital representatives. We haven't gotten quite the same network that I've heard. I like the emphasis on legal aid. That I've made notes that's where we need to go next. But these are the groups that we've involved to date. We've been in operation for several years, and as I mentioned, we really look at a variety of different topics, and this is a graphic that we've borrowed from HUD to help explain the rationale and why we work on these different things. And again, following that, what's the hazard, what's the health effect, what's the economic impact. We try to frame our discussion points and our education points around that. We also have used these resources from the federal level to help define what the work we would do and what interventions we would promote. We're really working to promote the interventions that have sufficient scientific evidence that making interventions can reduce health issues, including integrated pest management, moisture elimination, radon mitigation, smoking bans, lead paint hazard control. These are the types of things that we're working to do. As we've started and formed around general education, we realized we needed to have one priority topic area and aimed to have a policy goal. And so we selected asthma as our priority topic because of the significant public health impact. We, in Colorado, do not have, at the state health department, a statewide public health coordination or funding for asthma. And we saw it as something that could align with department strategic plan, particularly areas around reducing health inequities. And so then the goals that we articulated was to get first Medicaid, private insurance, but also private insurance reimbursement for in-home asthma assessment and education, as we've heard some of our partners say that they do have in their state. I heard that in Ohio, they did get a state waiver. We also are looking to apply for funding for statewide program and to do the coalition. As at this point, no resources are set aside for our coalition. We all just come together because we see this as important to furthering our own work. We have looked at a variety of different data sources in order to help guide our decision making. And here as I mentioned, we're starting with Medicaid as the first priority, and we decided to really focus on the data about children under age 17, really, but really under 18. In here, we're looking at private. The blue lines are are Medicaid children who are covered by Medicaid. The red line, children who are covered by private insurance, and the emergency department hospitalization or emergency department visits for this age group. And so we see that Medicaid is paying a really very high cost for ED visits due to asthma. And so we've prioritized our work at trying to get reimbursement at Medicaid. We also collected information that looked at studies that talked about how much in Colorado was being spent. So Medicaid is spending over $4.5 million annually on these visits. So with that cost perspective, then we started to meet with Medicaid and actually a network of people as part of the coalition to prioritize or to try to educate Medicaid on the importance of getting the reimbursement for home assessments. We held a summit with them and with other partners and identified the priorities that we wanted to address. We've also developed an in-home assessment tool and family-friendly educational handouts, and we've engaged in a pilot program to help identify how these in-home assessments should be structured and looking at return on investment. A couple of these programs so far have already collected enough information to show that there is an important return on investment. If we do go into the homes of these children that are having high or frequent ED visits and do mitigation, do some assessment of the home and reduce those asthma triggers, the program pays for itself and then some. Here's a look at the in-home assessment form. We're piloting this in a variety of different programs, both in the lead home assessment as well as just a general healthy homes approach that we're using in a couple different programs, and it helps identify things that need to be, that are everything, the green, everything's okay, minor, we ought to keep an eye on it, moderate areas of risk that could be addressed, and then the major issues that should be addressed now. And then an accompanying handout for families that helps explain what was found in the assessment and easy steps. We try to keep it at a 3-step things that you can do based on, and again, what would get pulled up for this handout would be based on things that were found in the assessment. And some of the programs that are piloting this in Colorado with Children's Hospital, they've got a 3-year, that CCPD stands for Cancer Cardiovascular Pulmonary Disease Grant. It's funded as a part of the tobacco tax here in Colorado, and they're looking at doing the pediatric asthma program in-home assessments. There's another Step Up program that's working with schools, and the Denver Public Health and Environment also receiving a grant to do the in-home assessments. The city of Fort Collins, this is a model we really like. It's funded by the city itself. The city has created a budget line item for a Healthy Homes program, and they have an in-home assessment to look at indoor air quality. They train a large cadre of volunteers that help do the assessments, and they've just released a do-it-yourself home assessment tool that was featured in a webinar last week. So you can go back and find the information on that in the archives of this HUD Healthy Homes Month webinar series. We also do, as part of our coalition, we do a variety of different information webinars on these different topics: lead topics, radon, asbestos, ways to reduce asthma triggers, weatherization, household waste, and the pest management are just a few of the webinars we try to promote and provide on a quarterly basis, and we sometimes try to get creative with the titles of our webinars here. And here's a sample of the handouts that we provide for families, both in English and in Spanish, and then try to direct resources and education at policymakers and decision makers as well. And we're still yet to go with getting the decision in our favor from Medicaid, but we haven't given up yet. It's been a longer process, but we're still aiming to get there, and we'll look to scale that to the entire state. We've learned be proactive, but allow for an organic process, engaging the right people. We're really trying to stick to the evidence-based and the best practice, and look for these windows of opportunity with Medicaid when we see that they're making a policy shift or something, that's the time that we come in and try to do more education. I know that pushing the time here, so I'm going to just go to, here's how you can contact me if you have more questions. Thank you.
Thank you, Jill. Can everybody hear me okay?
Yes.
Yes?
Yes.
Okay, I was just checking. We had a little bit of a glitch on the sound quality, and I want to make sure that I was still being able to hear. Okay, so thank you to all the fantastic presenters. This is a fantastic panel that we had here. What I'd like to do now is, if you have any questions that you would like to ask any of the panelists, you can either use the questions window or the chat window, and I will try to read those off to the panel. If you also want to raise your hand, I can try to unmute you if you cannot unmute yourself. So now's the time for anyone to ask questions. Let's see. Brandon, do you have any last thoughts you want to give, or any of the panels have any last thoughts you want to give?
So I realized that I didn't have my email address. I thought I had my email address on the last slide, and I didn't. So if you're interested in the National Healthy Housing Learning Community, my email address is Brandon, BRANDON, at RAMP, R-A-M-P, asthma, ASTHMA.org. But definitely thank you. Thanks to HUD for having us, and definitely enjoyed the presenters.
Okay, thank you, Brandon. So one of the questions that came in is about whether the slides will be available. So the answer is yes. We actually do record each of these webinars, and so you can view them, at your leisure. Or if you have people who are working for you or colleagues that weren't able to make today's webinar, we usually post those on our National Healthy Homes Partnership website, and we also give a copy to HUD, and HUD also, I believe, posts those on the Healthy Homes HUD website. And then along with that, we usually we will put the PowerPoint slides in the same link to that. So you will get information as a participant today in the webinar. You will get information on how to get to those slides. Are there any other questions? Well, on behalf of the National Healthy Homes Partnership, HUD, Office of Lead Hazard Control and Healthy Homes, and USDA NIFA, we thank everybody for attending this webinar. Please feel free to email me if you want to get in touch with any of the presenters, and I will be ending the recording soon. Thank you for attending, and I look forward to seeing most of you at future webinars for National Healthy Homes Month.
Thank you.
Thank you.